In the Presidency, responsible for women, youth and persons with disabilities, held a webinar today on the impact of alcohol on crime and gender-based violence in South Africa. The objective of the seminar was to create awareness of the link between alcohol abuse and violent behavior, and also provides a platform for discussions of possible measures to curb alcohol abuse. Mmabatho Ramagoshi is the special advisor to Minister Nkoana Mashabane, and she joins me now live via Zoom. Good afternoon to you, Mmabatho. Thank you so much for joining us here on the SABC News channel.
Good afternoon.
All right, so we understand that the objective of the seminar was to create awareness of the link between alcohol abuse and violent behavior. But who is this awareness aimed at? Who were the participants of this particular webinar?
Thank you, Palisa. The webinar was more than raising awareness. It was also to understand actually the facts from researchers, from health officials, from people who have been working with perpetrators of gender-based violence, and most of them being men who are under intoxication. So we had a seminar where we invited researchers, we invited WHO, that is an organization dealing with health from the UN globally, but also we invited South African Medical Research Council that has been doing a lot of work linking violent behavior with gender-based violence, so that we understand what drives, what is it that makes these people to be abusive when they are drunk. And also we invited people like the He for She campaign from the Catholic Bishops' Council that works with taverns, because they work with men at the taverns to understand them why after drinking they can't stop, to understand what is it that makes them to stay at the shebeen until AMs, but also to understand from research what have they found in communities where there are shebeens, because in the National Strategic Plan on Gender-Based Violence, one of the things that came out from communities was that there are a lot of shebeens in South Africa, and most of them don't comply with regulations. Most of them open almost 24 hours. So as a result, women and young people around those shebeens are always confronted with violence. Now, the webinar has happened at the time where we're now at level 2 of lockdown, and we have seen just the unbanning of alcohol in these 2 weeks. The high level of accidents that are linked to alcohol driving.
Right, so
and also in hospitals now, they are seeing...
I want us to put the numbers to this pandemic that we're facing of gender-based violence. So what does research say, and perhaps practical experiences in terms of the link between alcohol abuse and gender-based violence? Do we have the numbers in the country?
The numbers in the country that comes from the researchers, the one research was basically from the Western Cape, and that research indicates that with the number of people that go to hospitals due to injuries, that there will be injuries from accidents, injuries from crime basically, but injuries from alcohol-related incidences will be almost 20% in the Western Cape. And they indicated that all those have went down during level 4, 5, and 4. And we know that in level 3, when alcohol was unbanned, in 2 weeks' time, we had almost 29 women who have been killed. And hospitals, the numbers in the emergency were high. So we are able to show a correlation between gender-based violence and alcohol abuse. But for us, the issue was not only to highlight that. Because identified in the strategic plan, we need to see programs that are working, that we can implement nationally, where we will be able to attack the behavior before it starts. So we're looking at this webinar that can be replicated also to provinces, to engage the industry. We invited the SAB itself and the whole, the SAB and the AB in BEV, where they also presented their programs that they put in place to ensure that people who abuse their alcohol are given responsibility for their action. They are partnering. They gave us an example that they are in partnership with the Department of Transport, and they are looking at even enhancing the machines that they use to test people who are drunk. Mm-hmm. So we were looking at, number one, they need to start engaging the taverners. Number two, that came up in the discussion was that maybe we need to increase the age of people drinking. There was an issue that they need to maybe also not advertise alcohol, because young people see these adverts as something very exciting. Yes. So they want to test their alcohol.
All right.
There was an issue of why in the food industry, when there was an issue of obesity, issue of sugar was looked at, made to increase the alcohol content in their whether beers or wines, so that we do not have people who can't even handle alcohol and they end up being abusive.
But then also, Mmabatho, I think the question is, what will the department do to ensure that this was not just another talk shop? Because discussions have been heard before. We've had webinars, engagements have taken place before. So what happens now moving forward? Now that you've spoken to the researchers, now that you may have a slight idea of what the problem may be, what then happens as you say that you're looking into rolling out the programs nationally?
We invited also the parliamentarians, because the issue is that if there is a gap in legislation that ensures that the industry itself does not comply, then we need to ensure that we've got legislation that will enforce the industry to comply. But also for the minister, as the chairperson of the Interministerial Committee on Gender-Based Violence, to talk to cabinet and indicate these findings from the webinar, and talk to the Minister of Police, because the biggest thing that came out, even from the Catholic Bishops' Conference, was non-compliance of Shebins. So that they need to take best practice models from countries where there are times where alcohol is not allowed. There are times like now with the shutdown. I mean, it was an accident for us to learn that actually if you close these areas at this time, you are saving more lives. So there will be recommendations that will go to cabinet, but also the proposal that came from some members of parliament was that we need to look at the issue of legislation.
All right.
So that it is not only a talk show.
All right.
Remember, the department is monitoring the department lobbying. So ours is to ensure that we strengthen legislation policies will be implemented to save the lives of South Africans.
Okay, no, it looks like we're losing that line. Fella, thank you so much, Mmabatho, for coming through. Mmabatho Ramagoshi is the special advisor to the minister in the presidency responsible for women, youth, and persons with disability, talking to us about the impact of alcohol in crime and gender-based violence. We do know that the National Strategic Plan on Gender-Based Violence and Femicide also highlighted a number of drivers of violence, and alcohol abuse is certainly one of those.